Good morning. If you have decided to study to become a professional hypnotherapist, continue with us in this beautiful project of study and learning. Hypnosis is a powerful technique with which you'll be able to help and improve the quality of life of a great number of your future patients. Remember, study the description of this video where you can find a link to free clinical hypnosis training classes with several free ebooks. Self-instructions. Introduction. Self-instructions. Mission-bound, 1977. Aimed at implanting ideas and rational verbalizations suitable for adaptive coping. Adaptive coping, according to this author, it is more effective to pronounce aloud self-instructions than to read them out loud. Instructions is more effective than reading them out loud. Self-instructions are the utterance of a series of stimulating messages, which consists of giving oneself the necessary instructions to enable the performance of coping of a certain task, situation, or event. This can be generated by the patient or provided by the therapist. Guided self-instructions. The aim of self-instruction training is that the patient learns to establish concrete and correct self-verbalizations for specific situations, tasks, or coping events. Self-instructions guide behaviors, especially in new and complicated situations or tasks. The aim of self-instructions would be to vary and appropriately direct the person's internal dialogue to help him or her cope with a fixed situation. They are used to break down an activity or problem into a series of steps, where each self-instruction is a step towards solving a situation or activity. Learning to give effective self-instructions is a good way to reduce anxiety, and thus to be able to perform or cope with a certain task, situation, or event in a more relaxed and calmer way. We must teach our patients to give themselves self-instructions to reinforce the hypnoid treatment that we are applying. In this way, the patient learns to talk to himself in order to provide the correct guidelines in the resolution of tasks. In this way, the patient can face a certain task, situation, or event with greater success, thereby increasing their self-esteem and self-control. By means of training in self-instructions, the aim is to reduce the defeatist and, above all, negative internal monologues that the patients have, such as, "It is not worth trying anymore," "I'm not going to make it," "I'm going to fall back into the habit of smoking," "I'm going to fall back into the world of cocaine," "I'm always eating," "I can't control it," etc. By positive self-instructions that guide towards action and coping with a given situation. "It is worth trying," "It is not easy for me, but I will keep trying," "Next time it will be better," "I am a non-smoker," "I have stopped using," "I'm strong," "I'm very brave," "I'm going to quit," "I'm going to try," "I have stopped using," "I am strong," "I'm very brave," "I'm going to try." These self-instructions can be given by the patient himself or by us, the therapists. either under hypnosis or in the form of guided self-instructions. We must teach our patients to change their negative and inappropriate self-instructions into positive and more appropriate ones. In the following, we are going to see different types of self-instructions. These have to be kept at home, in the patient's room, in the wallet, etc. They should have them at hand for when they need them. For example, to counteract a crisis. The crisis situation will depend a lot on the resources that the patient has to overcome it. The self-instructions are one more resource that the patient can rely on. This type of exercise is very important for hypnotherapy, as it helps the therapy to be much more effective. They are exercises that the patients must practice on their own, tertiary exercises. Don't confuse the specific moment, the urge to smoke, with the consequences of the decision to smoke just one cigarette. You will pay a very high price. There is no single cigarette that is false. So stop kidding yourself and face reality. Smoking is over for good. If you smoke just one cigarette, you will fall back into the cycle of addiction and all that goes with it. Self-instructions for anxiety. 1. Detect. You have detected your emotions. 2. Stop. Stop the thought that has led to your anxiety. 3. What's wrong with me? Define the problem. 4. Goals. You must lower the emotion. 5. What can I do? Look for alternatives and don't fall into despair. It can also be done in this other way. 1. I detect that I'm becoming anxious. 2. Stop. 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 3. What's wrong with me? I have anxiety, and this makes me exaggerate everything that happens to me. And any problem I have, anxiety amplifies everything negative. 4. What can I do? Cut or lower the anxiety. 5. How? I can use the paper bag technique. I can also use the 10,000 technique. I can also do a quick relaxation. I take a deep breath, hold my breath for a few seconds, tense my body, slowly release my breath while I relax my body muscles. If you're interested in learning more about clinical hypnosis, watch our next video. Remember to study the description of this video, where you can find a link to free training classes about clinical hypnosis, with several free ebooks as well. If you have questions, ask them in the comments area. About this topic and many others we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, don't miss our next videos. Thank you very much.